This recording is about the air polishing Prophy jet. It's in Wilkins, chapter 42, just on page 739. And it has a few pages that it talks about this if you want to refer to the Wilkins book to kind of brush up on it. So the principles of application for an air polisher, it's for stain removal, biofilm removal, usually after biofilm instruction to the patient. You'll do some instrumentation with your hand instruments or the ultrasonic. And then you will do periodontal debridement or scaling, and when they are completed. So you're going to use an air polisher in place of actually polishing with the polishing cup. So you're going to go ahead and treat this patient like any other patient. You are going to go ahead and scale, use the Cavitron, etc., like I said, and then you're going to go up and sign up for a scale check. Then after the scale check, you would use this air polisher and then go and sign up for a polishing check. So we use a specially formulated powder. There are different kinds of powders at the clinic, and in a lot of practices they'll use sodium bicarbonate with flavorings made for the taste, and that's specially made for the polisher. So sodium bicarbonate is baking soda. You cannot just go to the store and buy regular baking soda. It needs to be formulated and ground so that it works in this particular machine. It also, they have aluminum trihydroxide, glycine, calcium carbonate, calcium sodium phosphosilicate. So glycine is really good. That's a really fine powder and needs a special they have hand polishers actually that just fit in your hand. Ours is with a machine very much like the Cavitron. The particular machine that we have that has this air polisher, and we only have one, is a Cavitron and then an air polisher all in one machine. It's just bigger than the normal Cavitron slender machines that you see in every op. This is a larger, and you can, it has instruction to switch the dial to use the Cavitron. You have to do a few other things, use a different kind of a tip and a different kind of a hose for it. So we'll be showing you all of that in clinic. So the uses and advantages of an air polisher. It takes less time, which is ergonomically favorable to you. It's favorable to the patient as well because it does not take as long of a time to polish their teeth. There is no heat, less abrasive than a polishing paste. It's great for orthodontics, tobacco stain and chlorhexidine stain, and it's used sometimes prior to having sealants. So this is what it would look like on the different surfaces of the tooth. You can see the spray. And this would be the spray coming out of the nozzle. And when you are on the lingual side of the anteriors, you would go ahead and use like a 50 to 60 degree. You wouldn't put this exactly 90 degrees to which would be more like this. You want to put it more like 55 to 60. You want to just curve it up a little bit, because if you put it just flat on, just exactly 90 degrees or perpendicular to this line per se, it's going to shoot right back in your face or all over your face shield. So you want to keep it at a slight tip. Then when you are on the buccal or lingual side of a molar, you want to make it kind of slightly this way instead of, once again, perfectly straight. You want it to go, I'm not doing this very well, up this way. So you're just tipping it just a little bit, and you never want to tip it so it's pointed down into the gums, but you just leave it about this far away from the gingival, the papilla right here. You don't put it any further down than that because it would be forced down into the, right on your tissue and down into the sulcus a little bit. What you want to do is have it up about not quite midway to the tooth, but just a little bit below midway, and then just tip it a little bit so that it's pointed slightly toward the gums. And so you would do it that way. And when you're working on the occlusal surface, then you can make it 90 degrees to the occlusal surface. Just flat on the occlusal surface. That won't spray back on your face. It will spray mostly into the patient's mouth. But of course, you're going to be using an N95, like with the Cavitron. You are going to be having another, like a level 2 face shield over that mask, and then have your face shield on. So you always keep this a little bit of a distance from it. You never ever put this nozzle right straight up to the, right on the tooth. You just kind of back it up just a tiny bit. So it's about 4 to 5 millimeters away is all. So this looks even further than that. You don't need to put it back that this far. It'll spray everywhere else. You just need it about 4 to 5 millimeters away from the tooth would be great. So keep it in circular motion. I mean, you just kind of go like this around the, which looks kind of crazy, but the spray just really sprays out. And so you don't need to keep it. It's like a lot of these are coming out, not just one straight stream is not coming out. So it covers a lot of the tooth surface with just like a circular business like this, and then you're done with that, like the whole buccal side of the upper right quadrant. It's like you start back at number 1, and you would just point it like in this fashion right here at this B, and you would just kind of be going in circles like that all the way up to 8, and it's done in just like a couple seconds. And you go around the whole mouth like that, and then you do the linguals and then the occlusal surfaces of your molars, and it's done. And it takes much less time. So the spray is angled away from the gingival margin. The periphery of the spray may be near the gingival margin, but the center is directed always away from the gingival margin. So recommendations and precautions. It is an aerosol, so we of course need to take the precautions I just spoke of with that. So you're going to use a pre-procedural antibacterial mouth rinse or Listerine. We have to use the high evacuation is always preferred. In fact, it's not just preferred right now through COVID, it is required. Your protective patient and clinician procedures. You're going to use the PPE. You can lubricate the patient's lips to prevent drying effect of sodium bicarbonate using a non-petroleum lip lubricant. Petroleum products seem to damage the integrity of our gloves, our patient gloves, and so it's not supposed to do that much damage if as long as you're not using latex. If you're using nitrile like we have, you can use a little bit of, a little bit of petroleum lip lubricant, and it doesn't do that much damage to the integrity. So you never direct the spray at the gingiva, the perio pockets with bone loss. You don't put them across porcelain crowns. You would just skip that crown. You would, if you had like number 5 was a crown, you would start at 1, 2, 3, 4, kind of skip 5 and go over to 6 and 7, etc. Or into any kind of an extraction site, which I think is probably pretty obvious. So the risk patients that we have where the air polishing procedure would be contraindicated would be those that have a sodium restricted diet. Shouldn't have it, although they do make a powder that is sodium free. Respiratory diseases should not be air polished, end-stage renal disease, or any kind of a communicable infection because of the aerosols. And so naturally we're going to use selective polishing like we do the regular polishing. If a tooth is not stained, then you might kind of skip over it. But the air polisher does a lot. It's really good for taking a lot of different kinds of stains off. Not all of them, but a lot of them. So other contraindications would be root surfaces. We avoid routine polishing of the cementum or dentin. If you have soft, spongy gingiva, like as in any kind of an infection, inflammation, or in particular you have gingivitis, your air powder can irritate that. So we tend not to do it for these types of people till their gums kind of heal up a little bit. Any kind of restorative materials, this air polisher can cause removal or pitting on any composite resins and cements or other non-metallic materials. So, contraindications for air polishing may include all of the following except one. Which one is the exception? I'll just let you look at that for a minute. Sodium restricted diet. True. You would do it for that. Respiratory disease would be a contraindication. We heard about that, so that would be true. End-stage renal disease. We wouldn't want to use it for that. Alcoholism or anemia or something. This is the one that's the exception right here. It would be false. Alcoholism has nothing to do, or anemia doesn't have anything to do with being able to be air polished or not. And I choose this question because I've seen it on some midterms or finals, any quizzes, and I certainly have seen it in review books for boards. So that is really quick. You can kind of go over that. You can read the supplemental pages in the book, and we'll be showing you this in clinic as well. And also there are some videos on it on YouTube.